last YouTube there were a lot of uh, there were a lot of questions which I could not answer because of the shortage of time. So if you join in, make sure that you first ask the previous question so that we can again recap that. In the meanwhile, let us see one case. Now I'll discuss a case of headache. I hope everybody joins in early so that there is no backlog. I have to again repeat the same question again and again. So this is a case of migraine. Now migraine, I have lots and lots of cases of migraine every day, about 8 to 10 cases of migraine. This was a case of migraine patient which had headache problem, diagnosed as vascular headache, migraine headache, lot of type of headaches, but there was no change in the patient. He took allopathy medicines, homeopathy medicines also. He was with me also with for 2 or 3 months, but there was not much considerable change in the patient's headache. The whole case was taken. I prescribed the drugs, but it was not showing good results. And one thing, then I asked the patient what exactly the patient does. What exactly the patient does during headache. And his wife told me, my husband, when he gets headache, you just cannot do anything. You cannot talk to him. You cannot tell him anything. You cannot tell him to go out. He becomes so irritable. He does not want to be touched about anything in life, whether it is career, whether it is his son, whether it is the money problem, whether it is business, whether he will just not answer anything. He becomes so irritable. He just wants to lie down. That was the patient's explanation about the husband during headache. And this was the thing which I took for prescription, and I gave the remedy. And with that remedy, gradually within 3 to 4 months, his migraine was treated and cured with homeopathy medicines. Now it is a question for you, which remedy I took and what is this symptom which I took for prescription. In the meanwhile, I'll just welcome Dr. Pandey, Dr. Motwani, Dr. Elizabeth, Dr. Babel. So one question, high BP due to long-term use of steroids inhaler in a chronic asthmatic patient. See, this is a very common symptom that lot of patients who are taking asthmatic remedies, especially salbutamol and terbutaline, they either get trembling or high BP, or you have taken a lot of steroids and you get high BP. So normally, if this patient comes to me for treatment, there are two opinions for me. Either you basically give the patient the similimum. If you feel the similimum is right, it will act as an antidote as well as a curative for the patient. But a lot of doctors ask me, sir, what to give in order to neutralize this. In this case, if you have patient is taking a lot of steroids, there is a very interesting remedy in Homeopathy Metamedica, cortisone, which is made of steroid only. You can start with giving cortisone 200 single dose, wait for about a week's time, then again take the whole case of the patient, and then you can prescribe your indicated remedy. This is how I deal with the case. It is not always that you give Nux Omega. No. You have a specific cause, taken a lot of steroids, you can start with cortisone. Okay? Yeah, well, good afternoon, Dr. Disha. So that case which I had of migraine, which I told you what to prescribe, which remedy I prescribed and what are the symptoms which I took for prescription, that is a question. I hope you start answering that. Yes, cortisone. So thank you to my fellow doctors who are there online and they are writing the name of the medicine. So then there is no disparity while I'm very fast and you can understand. So if you don't have the answer, the rubric, the symptom which I took for prescription was touched aversion to being in headache. The wife told, you cannot do anything to my husband. He's so touchy, he becomes so irritable, you cannot talk about the child, about the money, about the career, about the work, about anything. He becomes so irritable and angry. There's a beautiful rubric in the mind, touched aversion of being in headache. Okay, touched aversion to being in headache, and the remedy, again a question to you. So Dr. Baba, asthma patient is better since some days with your help. Give the remedy before but not in the potency and not after nose wound. Now it is working. Thank you so much. Yeah, very nice. Very nice. Dr. Barbel. So that was, uh, that is basically a myth that the patient, there are a lot of patients in India which get relief, and in Europe the same does not work. It works everywhere, simple homeopathy I think would cure the case. Yeah, welcome. Yeah, Dr. Alexandra, welcome. Uh, Arnica touch aversion to. Okay. No, I did not give the patient arnica. Can varicose vein 100% reverse? Depends on case to case, my dear friend. Depends on case to case. But definitely you can get good results with this. Good morning, Dr. Alexandra. So, that patient, if you say, now again an implied rubric which I want to tell you, and that is not arnica. There's a rubric called as touched aversion to being in headache, and the only remedy in that is zincum metallicum. So I prescribed the patient zincum metallicum 200, and after 15 days zincum metallicum 1 mg. Now it has been 3 months and the patient has, since last month he had no episodes of migraine and headache. 2 months before he had 2 episodes, but much better. So zincum metallicum 1 mg has literally cured the case or treated the case. I will still tell you how does the patient behave during an episode of pain is very important to understand. Okay, injury is something different, being touched is something different, and there's one more rubric called as touch things implied to. Touch things impelled to. He wants to touch everything. That's the literal meaning. Touch impelled to means he wants to keep this person happy, this happy. How are you? Everybody wants to keep happy. Everybody wants to keep a rapport. He wants to maintain a good PR. In that case, you must think about the rubric touch things impelled to carcinosin, thuja, belladonna, sulfur. Fantastic remedy, especially in children's, cinnan carcinosin. Okay, so this is how you have to use the implied rubric in a practice and you will get good results. The case which Dr. Barbal is telling is the case of asthma, which I saw when I was in my lecture in mycin, and he's much better with homeopathy treatment. Thank you so much. I think that case was taken in front of a lot of other doctors also, and he's much better. Yeah, Dr. Shiva Krishna. Welcome, Disha. Patient with diabetes better with acid phosphate, gymnema and cephalendra Q till 6 months. Now again, fasting 170, post meal 210, HbA1c reduced from 9 to 7.9. Very well, Dr. Disha, there's no problem. You have to give gymnema in LM potency, first of all. Cephalendra Q you can continue. Acid phos you can do repetition in sometime in diabetic cases when the HbA1c is not below 8. You have to repeat monthly once. So if you follow this protocol, I think the patient should be much better. And of course, tell the patient to have a very good diet. In diet, one thing is very important that I have seen in my practice. In patients which have not treated cured diabetes, first thing, have lot of raw vegetables in your diet, that is salads, before meal, and change from wheat to javari or bajra, or you can say millets. Second, and third, which I have seen, is at least 45 minutes brisk walk. If not, the patient is sitting, has a sitting job, then exercise of calf muscles is very important. So these 3 things added with your medicine would definitely help the patient. Of 7.9 HbA1c, it will come to 6.5, 6.8. Of course, if you see the WHO recommendation of HbA1c and post-parental sugar, this level is taken as normal. Please share remedies used in cancer of lungs. Last week only I had a case of cancer of lung, and one of my assistant doctor rightly pointed out the rubric, very much foppish. So of course, the patient has just come to me and it's only 1 week now, but I cannot tell you the exact remedy for cancer of lungs. I basically don't prescribe only on the symptomatic, the disease process, but in lungs you can think 4 or 5 remedies which are very important. First is phosphorus. Second is beryllium matte. Third is beryllium. There's one more drug which one more drug which I'm not getting. Fourth is aspidosperma, Merxol, Thuja, and I have got sometimes good results with curcumin, that is haldi, when there is a lot of expectoration and which is very much offensive. Okay. Hello sir, could sulfur toner in a patient cause aggravation? If it's not suited to patient, can medical aggravation cause the high level of LDL cholesterol because sulfur has called to be? No. I have not seen cases where the patient you give and suddenly there is a lot of aggravation and cholesterol is high. No, not possible. But still, if you feel, then you give sulfur in LM potency and that would be better. Okay. Later, no, cholesterol, cholesterol, sulfur. See, if you see sulfur will cover everything from head to foot, from head to foot. But when you give a remedy and the pathology increases, no, not possible. What is the meaning of medicinal aggravation? That means the aggravation only which can be seen and pursued by the doctor only, not the patient. It is not so much. Otherwise, if you see cholesterol increase with sulfur, the remedies are the max floor is there, cortisone is there, chloroform is there, dulcamara is there, and you give dulcamara. If it is wrong, then cholesterol increases, not possible. Okay, so don't worry about that. It will not increase the cholesterol. I have told you the entry point of cholesterol, and there are so many cases in my practice where cholesterol is much better within 3 or 4 days also. If you had seen my video of stricture of urethra, I think previous video, if you see previous reports, if you have seen grade 4 fatty liver, which was better in 15 days time, and the patient, a lot of doctors asked me, sir, how come so fast? That's why I have posted a video of stricture of urethra in a person who I treated and is much better, 80-90% better within 1 month of treatment. So proof is very, very important. Transparency is important. Although I always tell to my webinars and in Zoom meeting, every video I cannot take, every shooting I cannot take. So those who believe in me, I don't need to give them proof that this is worked and this is very fast and this is there. But some doctors always tell me that how come so fast. So if you have seen my video of stricture of urethra, I have cured that case in one month's time. In fact, if you have seen today only, I have posted a case of psoriasis of palm, plantar psoriasis, which was treated and cured within 2 months of treatment. So in homeopathy, the right remedy can show beautiful results and very fast results. Okay, so it depends on case to case. My Europe group, which I had been taking webinars for them. For some point of time, I always showed them the results, before, after, and shooting. But there are a lot of cases which I don't shoot the case. So now, whenever I show them the case, they know that I have cured that case and I don't need proof to show them the video or the reports. So this is how I basically want to tell you that a lot of cases give good results depending on which simillimum and what potency you have given to your patient. Okay. So let us go forwards. I think Dr. Barabal and Dr. Alexandra will vouch for that because they have been attending my webinars for a long time. So let us go forward. I think few questions have been scrolled up where I forgot to answer because I am on the laptop now. Okay. So cancer of lungs. Of course, if you see, if you see the repertory, there may be a lot of remedies for cancer of lungs. But then, how many cases of cancer of lungs you have cured? That's important, and that's why I always tell you that it is important to know that how will you approach a case. For example, if you put cancer of lungs in the repertory, arsenic would be there, guaiacum would be there, methylene blue would be there, theridion would be there. But I have never used this remedy. I have used definitely Acalypha indica, where there was a patient of cancer of lungs. There was a lot of vomiting of blood, and Acalypha indica, they definitely relieve the symptoms of the patient, not the disease. The disease is still there in the patient. I'll check out on cholesterol video. Okay. Which rubric could be taken in case of hyperlipidemia? See, Dr. Thackeray, hyperlipidemia, I will never take the rubric cholesterol or direct rubric. I will never take. If you have attended my webinars or my YouTube live, I've always said cholesterol means there is a lot of accumulation. Matlab something has been getting accumulated. So whenever you start accumulating emotions, whatever emotions, it may be what we call emotion separation leading from money, related to career, related to family, related to everything, that suppression, that accumulation will give rise to cholesterol. In my practice, I have seen most of the cases grief silent. For whatever reason the patient is suffering from grief, there is silent grief, there is accumulation, and cholesterol starts accumulating. The patient of coronary artery disease also suffer from these type of complaints. So a lot of cases I have seen accumulation, silent grief. These cases develop this cholesterol or hyperlipidemia in my practice I have seen. So I hope this helps you in your practice. Direct remedies, I will not be able to tell you because I don't use this type of remedies. A lot of doctors before used to tell me that cholesterinum works very well in cholesterol cases, but I have not seen such type of results with cholesterinum. So I would go with the normal homeopathic case taking. Okay, if you are happy with the answers, you at least write something. So I know that I am talking to somebody and you are understanding what I want to talk to you. I hope you understand that. So if you keep sharing that you're understanding, I am also very happy. So I know that the answers are being taken well with you. Okay, so there are some doctors who are writing 100%. Thank you so much. So I hope you understood the rubric touched, impelled to, and touched desires to be. That is very, very important. Now, if you go further in that rubric, there's one more rubric called as touched aversion to being. Now, it is not that you touch a person and you don't touch me, don't touch me. This is the literal meaning of touched aversion to being. When I was reading the repertory, I had never used this type of rubrics. But implied rubric, touch means dur, be away from me, don't come over me. I am very happy, you be happy. Touched aversion to being, don't disturb me, aversion to being touched. Entim crude, Arnica montana, Kali carp, Tarantula, Chamomilla, very, very important remedies. But of late, I had a very interesting case, where touched aversion being, that was again a case of migraine. Aversion to being touched, and one symptom was that he said, sir, whenever I get headache, I am absolutely thirstless. I cannot drink water. I cannot even sip water. Combining these two rubrics, aversion to being touched and thirstlessness during headache or thirstlessness during headache the only remedy was hydrogen. I prescribed the patient hydrogen 200. He is much, much better. This is the beauty of homeopathy, That's why I'll tell you, the understanding of implied rubric is very, very important. I have been telling and making understand this implied rubric in my OPD to doctors who are working with me. Of late, I have been having 5 to 6 assistants who are working with me, and telling them and looking at the expression on the face, I'm so happy that they are learning something new. Make sure that you understand the meaning of implied rubric and then apply. You will definitely find wonderful change in your practice. There's actual research done on, I've seen many times equal medicine resolve the case. Sometimes you do have to, definitely, Dr. Neil, absolutely right. Sometimes, lot of times, I had a case of cancer of mouth, cancer of tongue, where I give the patient sempervivum. Sempervivum tinctorium is a acute remedy for the acuteness of the symptoms. I had a case of cancer of gums, where the patient acute, I gave the patient coffea cruda because the patient was much better by holding cold water in the mouth. It is definitely, you have to give organ specific remedy. For example, if the patient comes with acute asthmatic attacks and don't get symptoms, we definitely give Blata rescue. If the patient is outside, he calls me, sir, severe pain in the renal area because of renal colic, I tell the patient, give Berberis vulgaris to the patient, mother tincture. I definitely tell them, this is definitely there. Okay, so you have to give the medicine. Very bad case of vertigo, the slightest motion even of eyes, the room spins on. Okay, go higher. So vertigo, okay, the slightest motion I will just, I'll just quote one case, Dr. Alexander, before I give you the exact remedy. I had a case of vertigo, similar case of vertigo. The vertigo was so severe. When I asked the modality of the patient, in fact, my assistant took the case and she came and told me, sir, she has vertigo from everything, from getting up, from sleeping, from standing, from lying, from talking, from looking here, from looking there, sitting in front of me, talking, everything modality. So much so that when the case was being taken, there was a horn, there was a whistle outside, and she got vertigo. And this was the case. So I told my assistant, let us give the patient some remedy from the implied rubric. And I gave the patient Acerham euphorbium. If you have seen this remedy analogy, Acerham euphorbium, even the crackling of paper, the patient is sensitive. If you have Allen's keynote in front of you, you can. We gave the patient Acerham euphorbium 1 ml single dose, called the patient after 1 week. Believe me, the patient came and told me that she was 80% better. And she told, I hope you are not giving allopathy medicine. Because she was surprised that vertigo of so long duration, taken so much medicine, no change, a single dose of Acerham euphorbium. I prescribed on the sensitivity. The Acerham patient is so sensitive, in books it is written, even the crackling of paper, the patient cannot bear. And with Acerham, the patient was cured. Now coming to your question, Dr. Alexandra, if you have a lot of symptoms, sometimes, you spoil the case. I remember a case where the patient told me that even closing my eyes, I get vertigo. And at that time, I was prescribing, Matermedica and Repeatry type. I opened the Repeatry, I put the symptom, vertigo from motion, even on blinking the eyelids. And I got the remedy, Moscus. Even motions of the eyelid causes vertigo, Moscus. Believe me, Moscus did not cure the case. And then it was a case of a patient who was 78 years of age. Then I prescribed the patient Ginkgo biloba, 30 potency in repetition. After a month's time, the patient was much, much better. I just thought that at the age of 78, the patient, basically old age patient, because of arteriosclerosis, because of that, or the defective blood supply to the carotid arteries, that might be a problem. Ginkgo cured the case. Where Moscus, the symptom was there but did not relieve the case. So this is my experience of treating patients, sometimes on the implied rubric, which even I told you some of the implied rubric, Dr. Alexander, if you understand, the cases where cannabis was given, and 3-4 cases of implied rubrics, and that I hope you enjoyed that. This is implied. Sometimes typical symptoms present in the Matermedica, present in the Repeatry, but still does not work. Then you have to understand, and then you have to prescribe this type of remedy, which we never think about. In fact, if you understand, there's a rubric in vertigo that motion of the eye, the patient is looking here and looking there, that also causes vertigo. And that there also we have Moscus, we have Conium, we have Pulsatilla, and I remember only 3-4 drugs. So whatever case, you either take the sensitivity or you take the rubrics, both you have a choice. Dr. Josh, cervical infection, severe burning lesion, the husband, VDRL, papilloma virus. The severe cervical, do think about terebinthina, think about Uha ursi, of course, definitely think about Cantharis also. Okay, so Dr. Alexander, I hope you understood. I hope you got some idea about the implied rubrics. I'm enjoying teaching. I enjoyed teaching, so now I'm enjoying teaching my doctors who have joined me from the college. There are 5 to 6 doctors now. First of all, it was very difficult to teach them, but now I have segregated and I'm giving them rubrics. I'm also enjoying. They are also enjoying. Yes, Dr. Alexandra. Q, cervical infection, okay, my sister, terebinthina, Uha ursi, Cantharis. Do think about, these type of remedies, But again, if there is urine infection, you can also think about one remedy which have given me good results is cannabis indica and cannabis sativa. You can write one more rare remedy which has given me good results, that is cubeba, Cubeb, cubeba officinalis. This is the remedy. So this 5-6 remedy, just try to differentiate the remedy, and of course if there is multiple partner, because of multiple partner there's a problem, and recurrent infection, the patient is not able to recover, then you have to think about fluoric acid. Okay, fluoric acid. I hope Dr. Alexander remember those implied rubric cases which we dealt in the Myson webinar, that 4 or 5 rubrics I took. Enjoy teaching those rubrics because that gives you the adrenaline, something different and something very interesting in the cases to treat. Of course, I cannot cure all the cases in the world, but sometimes implied rubrics gives you that adrenaline rush, something different from the normal practice. Fluoric acid, yeah. I had a patient who had musculoskeletal pain from heavy exercise. Because the pain from the left side, we had to rule out heart disease. Rastos gave the reason. Okay, very nice. Very nice. Keep trying, but at least have some base of prescription so that when you fail, which everybody will, you know the reasons why you fail. So you do not repeat the same mistake every time. Write down something, because you have to fail to understand. You have to fail so that you can, succeed afterwards. So please write down why have you failed and what did you think about that at that time. So next time you don't repeat the same mistake. Okay, Dr. Neil. So let us go forward. Urine infection, I hope we did it. Medicine for pseudophakia, eyes with glaucoma and optic nerve atrophy. Peculiar symptom is he is not able to open eyelid when stand or walk, but open while sitting. I did not get the question, Dr. Navjot. Peculiar symptom is he is not able to open eyelids when stand. Okay, when he is standing, he is not able to open the eyelids. Very good. Again, I will tell you one thing. You have to be lucky, to get these type of cases. So in this case, frankly speaking, Dr. Navjot, I have never had this type of case where the patient is, standing and walking. So in fact, if it was not eye problem, and it was a generalized symptoms of walking, and that I could have told you a lot of remedies. For example, if you just see the case that the patient is better by walking, the patient desires to walk, walking ameliorates the complaint, there are a lot of remedies. For example, you can write down one remedy which comes to my mind, and of course I had given to it, but I have not had the case of eye problem. So patient is better by walking. Dulcamara, ferrum metallicum, pulsatilla, rustox, sulfur. These patients are better by walking, but not related to eye. In fact, today I think this is my homework. I will go and see if there is something related to eye. I have one thing where the pain in the eyes is while walking. I have had this type of symptom, but not optic nerve which you are taking, which is a very surprising case, So pain in the eyes while walking, I can tell you the remedy like zincum metallicum, pulsatilla, natrium arnica is there. But optic nerve involvement, I have not had a case in my practice. Okay. One patient with excessive masturbation for 30 years, now he is now 38, physically, mentally weak, also facing excessive premature ejaculation. You can start with the same simple rubric elements from masturbation, and you have a lot of remedies with that, element from masturbation. Of course, always don't think about the same cliched remedy, acid first, Staphylococcus aureus, calcarea carp, lycopodium. There are a lot of other remedies also you can think about. So whenever you are taking a case of masturbation, always make sure. There was a very rare case where I prescribed the patient origanum. Origanum. I prescribed the same case, plumbum metallicum. I prescribed the case digitalis and gelsemium also in cases where this element from masturbation. So don't always go to, of course, acid first, Staphylococcus aureus, lycopodium, calcarea, very, very important remedies, but don't have a fixity that these are only the remedies. Okay. Okay. So I think Dr. Navjot, if you can send the whole case, then I'll be able to answer that question better. Okay. So it is now half an hour up, and thank you for joining, and thank you for giving your comments also. And I hope you enjoyed as much as I enjoy sharing my knowledge with you. Until next Saturday, goodbye.